Henri Fayol Administrative Theory Application to Hospital Management. Got this picture. Administrative Theory 14 Principles by Henri Fayol applied to hospital management. Detail going on. Henri Fayol was French mining engineer and one of the earliest thinkers to formalize principles of management. His work laid the foundation for modern management practices. Fayol believed that management is a universal process and he proposed a framework that applies to all types of organizations. Fayol's 5 functions of management argue that managers perform 5 core functions: 1. Planning, setting objectives and developing strategies to achieve them, deciding what must be done, when and how. 2. Organizing, arranging resources, people, materials, finances to carry out plans, creating structure and assigning tasks. 3. Commanding, leading or directing, giving instruction and motivating employees, ensuring people work towards organizational goals. 4. Coordinating, ensuring all departments and individuals work harmoniously, integrating activities to avoid duplication of conflict. 5. Controlling, monitoring performance and comparing it with plan, implementing corrective actions when needed. Fayol 14 Principles of Management. These principles guide how managers should manage. 1. Division of work. Specialization increases efficiency. 2. Authority and responsibility. Managers have the right to give orders and must accept accountability. 3. Discipline. Employees must obey rules and agreements. 4. Unity of command. Each employee should have only one direct supervisor. 5. Unity of direction. One group, one plan, one leader. 6. Subordination of individual interest to general interest. Organizational goals take precedence over personal goals. 7. Remuneration, fair compensation for work. 8. Centralization, balancing central authority with delegation. 9. Scale or chain, formal line of authority from top to bottom. 10. Order, proper placement of people and materials. 11. Equity, fair and kind treatment of employees. 12. Stability of tenure, reducing turnover improves efficiency. 13. Initiative, allowing employees to think and act independently. 14. Esprit de corps, promoting team spirit and unity. Significance of Fayol's theory. 1. First, holistic theory of management. 2. Emphasized managerial training and universal principles. 3. Forms the basis of many modern management practices, especially in organizational structure and leadership. Criticism on this theory. 1. Overly formal and mechanical. 2. Assumes stability and predictability. 3. Less useful in dynamic, rapidly change environments. Application of Fayol's administrative theory in hospital and healthcare administration. Hospitals are complex organizations with many departments: nursing, surgery, pharmacy, lab, finance, HR, etc. Fayol's principles helps streamline management, improving efficiency and ensure high quality patient care. Application of Fayol's 5 functions of management in hospital. 1. Planning. In hospitals, planning is crucial because patient needs and resources must be coordinated. Planning, staffing, schedules, nurses, doctors, allied health professionals. Preparing budgets for equipment, medicines and facilities. Developing emergency preparedness plans, disaster management, outbreaks. Example, setting patients' care goals and quality standards. To organizing, hospitals must organize resources effectively, creating departments and teams, ER, ICU, pediatrics. Example, delegating responsibilities to specialists, chief nurses, head surgeon. Establishing hierarchy and reporting relationship, organizing medical supplies, equipment and patient records. 3. Commanding, leading. Leadership is essential for smooth hospital operations, supervising staff performance and behavior, motivating teams to maintain compassionate patient care, communicating with staff during crisis. Example, code blue situations, enforcing protocols to ensure safety. 4. Coordinating. Hospitals rely heavily on coordination between departments, coordination between ER, radiology, surgery, ICU, ensuring pharmacy, lab and diagnostic units support clinical departments, coordinating patients' flow to reduce waiting times, aligning community health efforts with hospital services. 5. Controlling. monitoring equity of care and performance, reviewing patient outcomes and satisfaction scores, auditing medication errors, infection rates and safety compliance, ensuring all departments follow hospital policies and accreditation standards, taking corrective action when performance drops. Application of Fayol's 14 principles of management in hospital. 1. Division of work. Surgeons, nurses, pharmacists, lab, allied health professionals have specialized roles. Specialization leads to better accuracy and faster patient care. 2. Authority and responsibility. Doctors issue medical orders, nurses follow documents, department heads manage teams and are accountable for outcomes. 3. Discipline. Staff must follow ethical standards, dress codes, and patient safety laws, maintaining punctuality and professional behavior. 4. Unity of command. Each nurse reports to one nurse manager, not multiple bosses. Prevents confusion in patient care tasks. 5. Unity of direction. All departments follow one hospital improvement plan or quality policy. Example, reduce infection rates by 20%. 6. Subordination of individual interest. Personal preferences of staff must not conflict with patient care. Example, a doctor external clinic must not interfere with hospital duties. 7. Remuneration. Fair wage for nurses, doctors and support staffs. Incentives for handling high cash loads or night shift. 8. Centralization. Decision like purchasing MRI machines may be centralized. Routine decisions, bed allocation, minor supplies can be decentralized. 9. Scale or chain. Clear hierarchy. Nurse, head nurse, nursing superintendent, medical director. Ensure smooth communication. 10. Order. Proper arrangement. Patient in correct wards. Equipment in designated locations. File and record management systems. 11. Equity. Equal treatment for all staff to maintain moral. Fair access to training opportunities. 12. Stability of tenure. Reducing nurse turnover improves continuity of care. Retention programs and career development. 13. Initiative. Encouraging staff to propose safety improvement or workflow optimizations. Example, nurses suggesting infection control improvements. 14. Esprit de corps, team spirit, building a culture of teamwork in words and units, celebrating successes together to strengthen morale. In summary, Fayol's administrative principles help hospitals: 1. Improve efficiency. 2. Reduce patient errors. 3. Strengthen coordination. 4. Maintain quality and safety. 5. Build healthy work environments. Thank you. Have a nice day.